When we talk about back pain, it's not just the sedentary office worker that normally comes to mind. There may be some of you here who do a lot of DIY or do a lot of gardening, and you're just sick and tired of that achy, stiff, sore back. And for some of you, it's got so bad that you get excruciating, severe shock-like pain and even numbness, tingling, pins and needles down the legs, or sharp sciatica. Every time you cough or sneeze, it might hurt. You're worried about going to the toilet because it could really hurt. Some of you, you just can't get a good night's sleep. How many of you cannot get a good night's sleep because of your pain? Absolutely, and how debilitating and demoralizing is that? Because it now affects everything. For some of you, you can't sit and even watch a movie anymore because you can't sit for more than 20 minutes before you really start shuffling and fidgeting around, or you get so uncomfortable that you have to just stand up and walk around. So even going to the cinema is something that actually is just too much of a challenge at this stage. For some of you, it might just be you can't stand for long periods anymore. So you might be standing at a pub and having some drinks with your friends, and you're constantly feeling like you want to go and sit down, and so you're actually turning down social events because you can't face the idea of being in pain for 2 hours that night because you know everyone's just going to be standing around. Cocktail parties, some of you may dread the thought of that because you're standing long periods. So I get it, I know what it's like. For some of you, it's just because you can't now play your favorite sport anymore, and we want to get you back on the road and be able to play those activities and sports like you used to. Back pain then comes in many different forms. It might just be tight muscles, or maybe you've lost all your range of motion. You're stiff and rigid like a board. How many of you are stiff and rigid like a board? And you're tired of that, right? Because you can't do stuff when you're so inflexible. Some of you are struggling with the leg pain, sciatica, swelling, burning, numbness. Okay, restless leg syndrome. Anyone got restless leg syndrome? Yeah, there we go. So these are things that really just are extremely frustrating at best and quite debilitating at worst. So we're going to do just a quick crash course in the anatomy of your lumbar spine, because you need to really understand the anatomy in order to understand function. So when you look at a lumbar disc, what you're looking at is the bone, the shock absorber, which is the disc, okay, and then the adjacent bone. So this is what we would call a segmental joint. As the alignment of these bones starts to slightly move off center or off its normal alignment, the disc now starts to get put under abnormal loading and pressure, okay, which is often what's associated with a lot of pain that people are experiencing, because the disc is highly innervated, very, very innervated, all right? And so you can end up with a scenario where the disc starts to degenerate like this, and it even starts to bulge out, because the disc is actually a fibrous cartilaginous piece of material which has got a jelly-like substance in the middle. And when these outer fibers start to wear and tear, they develop circumferential tears. And remember, they wear and tear because the alignment of the bones is not good. How many of you have ever taken your car to a garage because you keep getting balding on one side of your tire? And they tell you, well, it's actually because your wheel alignment's all off. Well, think of your disc is like the tire. And so if it's wearing out, it's because the alignment of the vertebra, the two adjacent bones, is not moving properly and is not aligned properly. Okay? So as you start to develop more and more circumferential tears in the disc, they eventually form radial tears that can track right into the middle and allow the jelly-like substance to start to squeeze out and start to create a bulge like what you're seeing here. All right? And that bulge is often then what causes irritation of this nerve, which is what can cause sciatic pain or numbness or tingling, pins and needles, okay, and many other symptoms as well. Or it could just be localized pain in the area. But you also could have absolutely no pain even though your low back looks like this. But you might have bowel problems, because this nerve also affects your colon. Or you might have things like restless leg syndrome. So it's not pain, but it's really irritating, okay? Or numbness, pins and needles, okay? Or loss of power. Or maybe your coordination is not as good. Or your balance, all right? You might notice that you're stumbling more and you're falling more. because the nerves now are being irritated, so you're not getting good, accurate information being sent back up to the brain, not just information being sent to the muscles and joints or organs. So as the alignment continues to get worse and the disc continues to degenerate, you can see how it just completely starts to fuse. These bony spurs are literally starting to fuse up, and so there's virtually no movement now in this spinal segment. And unfortunately, that's what happens if the alignment is not corrected and the normal disc motion is not restored. All right? So when you look at the spine, you should actually have this S-shaped curve. And the lumbar spine, this curve actually forms part of an ellipse, a bit like the shape of a rugby ball. Whereas the neck curve, believe it or not, forms the shape of a circle, like a football. And the thoracic spine in the middle forms a rugby ball shape, but in the opposite direction. And it's these opposing curves that gives the spine its strength. So when you lose those curves, you get abnormal loading being put on the bones, the discs, the joints, and the nerves. So when we look at your spine, we actually need to assess how well is the curve developed. Is it too curved, or has it started to straighten and it's not curved enough? Now, you cannot tell by just feeling a person's spine or looking at their posture. What do you think is the only way you can determine how curved their spine is? An X-ray. Without an X-ray, you have no hope of really getting an idea of how to fix your low back problem long term. You might get yourself some temporary relief, but unless you start to reshape that spine, you're not going to get any long-term correction. And that's really what chiropractic biophysics is. We want to reshape your spine. So we would expect to re-X-ray you several months down the road, and what would we expect to see? A change in the shape of that curve, okay, towards the normal ellipse shape. Okay, so let me just quickly draw something here for you. This would be the normal shape of a lumbar curve. So assuming that the bones are all here. All right, so this would be the front, and this is the back. All right, it actually forms in ellipse shape, a bit like a rugby ball, if you were to extend it right round. So it should form part of an ellipse, okay, the back part of these bones. And it's a specific height to width ellipse ratio. Now, being typical Westerners where we sit too much, all right, is the curve becomes too flat. All right, so instead of having a nice curve, it becomes very straight. And some people, it can actually be literally straight as a ruler. All right, and if it's serious, it can actually bend the wrong way. Now, for some people, the curve ends up being too much. And it causes different types of back problems. So for example, these people here, so let's just draw the bones here. You have to forgive my proportions, okay? And there's supposed to be 5 lumbar vertebrae. Okay, so these people here, this can often end up causing a lot of hip joint problems and a lot of groin problems, as well as a lot of low back pain here. These people here, where there's not enough curve, they tend to get a lot of very tight hamstrings, and they get a lot of back pain more here. Depends on what shape curve they've got will determine the kind of back problems you experience. Either can end up causing irritation of the nerves that are coming out at each of the levels, causing things like sciatica or restless leg syndrome. But in order to actually get a proper correction, long-term solution of your problem, we need to ascertain first, is it too curved or is it too straight? Or is there something else going on? Okay, or is it approximating near normal and it's more a problem from the front? Maybe the person's all shifted over to the side and it's not actually a problem with the side view. Does that make sense? So for some people, when you look at the spine from the front, you might actually see something like this. what's actually happened? My whole rib cage is shifted to the right. Okay, so maybe from the side they've got a reasonable curve, but from the front they're all shifted. And so the next time you're standing in front of the mirror, just check out the space between your forearm and the side of your trunk and see if one has got a bigger space than the other. Can you see how this is a much smaller space than this? Because there's a right trunk shift, which is actually causing my spine, which should be straight from the front, it's actually now causing it to deviate. Okay, or you might notice one's shoulders lower or higher, all right, which also can end up indicating things like scoliosis and other abnormal alignment problems and many others. Okay, sometimes you might actually notice when you look at a person from behind, the torso is rotated, okay, or the bum is rotated. So you're not seeing, if you look just behind the person and you look down at their shoulders and you look down at their bum, it should be roughly flush and straight, but you might notice the pelvis or bum is rotated or the shoulders rotated. So these are all clues that give you an idea, is your spine aligned properly? If not, chances are you're going to be getting abnormal loads and pressures, not just on the discs and the joints, but also on those nerves. And remember, those nerves are not just supplying muscles, they're also supplying organs as well, right? Things like your bowel, your prostate if you're a man, uterus if you're a woman, reproductive areas, and many others. Okay, so other health problems can start to develop because of your back problem. So we have a saying here, do you have a back problem or is it really a health problem? Because back problems will invariably manifest, if they're allowed to, into significant health problems. Can you understand now the connection? Remember, your nervous system controls everything. Okay, it's not just muscles and joints. All right, so we talked a little bit about how that disc herniation starts to bulge out, putting pressure on the nerve, and how that can end up causing sciatica. These are probably some better drawings than mine. So to really add confusion, the person is now facing this way. So obviously here, this was the front, this was the back, but we now got these x-rays are facing that way. So this is the front and this is the back. So this is a normal ellipse shape, okay? You can see the red dotted line here. This is where the person's lumbar vertebra actually is aligned, whereas the black curve is where it should be. And as a result of that, you've got abnormal loading on the disc here, and you can see the disc is bulging out in this MRI. So discs don't just degenerate because you get old. Let me repeat that. We don't get back pain just because we get old. Okay, that's one of the biggest misconceptions in society. So many things are just blamed on age, but actually it's more to do with how long have you been poorly aligned. That's the issue, not how old you are. You can actually have a person who can age really well and they end up going into their 90s and they're still playing 9 or 18 holes of golf, and yet you can have a 50 or 60-year-old who can barely walk down to the spa. So we cannot blame age. It's how long have you been poorly aligned that's really the issue. And the good thing is if you look after your spine and you keep it well aligned, it's going to look after you. It's really that simple. And we're going to talk about how you can do that. All right, so invariably, these are the kind of symptoms that typically doctors are having to try and use various different treatments and or medications to try and help people with. What do typically people get told? Heat and bed rest. Pain medication is probably the most common thing that people are told. Well, you're just going to have to take this Nurofen or paracetamol, and if it gets really serious, things like cocodamol, amitriptyline, all right, and we've got some quite nasty ones there because many of those are morphine based. These are opiates, okay, and they're very, very serious side effects to some of these medications. But these are some of the other things. But we're going to talk about medication first. How bad is it? Well, just to give you an idea of how much medication is being taken by the public and how it's increasing, this is a graph. It's actually from the States, but the UK almost mirrors it, just not in the same numbers, but the ratios are very similar. You can see just from 1993 to 2016, I don't have later dates than 2016 for this particular graph, but the amount of, in particular, opiate-based medications is going up exponentially. And how many of you would agree opiate medications are not good for your health in general? This was from the BBC. Opioids, why dangerous drugs are still being used to treat pain. This was in 2018. In England, GPs prescribed 23.8 million opioid-based painkillers in 2017, a rise of 10 million prescriptions since 2007. That's just in 10 years. 10 million more prescriptions. Why do you think people are wanting more prescriptions for back pain? Do you think our lifestyles though are worse now than they were 10 years ago? Would you say we're probably more stressed now and we sit more often and we probably work harder now? But also, people are being conditioned to think that this is an acceptable form of treatment. But is it really treating you, or is it just suppressing symptoms?
Suppressing them.
It's just suppressing them. Is this, I mean, if it was actually really good for you and it was actually going to help you get healthy, surely the people who took the most medications would be the healthiest people on the planet. How many of you would agree that that's probably not the case? Absolutely. So why is our answer to when we get any ill or ailment, we just look to the medicine cabinet? And it's because we're kind of being conditioned as a society to think from literally the time we're 2 years old, there's a pill for every ill. And health is never found in a bottle of pills. Health is found in improving the state of your nervous system and spine and how you eat, move, and think. Basically, diet, exercise, and self-talk. But because we're failing in those other four, we're resorting to just trying to bail us out of emergency problems with medications to just suppress symptoms. There were more than 2,000 deaths in England in just 2016 related to just opioid overdose. How many of you think it's time we started looking at back pain differently? Okay, so if drugs are not the answer, what's normally the next thing? If drugs don't work and you've been on them for long enough, what do they normally suggest? Possibly surgery. Well, how good is that? When we're talking about the spine now, this is basically what they do when you have spinal surgery. Rods and screws are there to buttress failed joints so that they don't move anymore, and so further wear and tear doesn't happen. But that doesn't, unfortunately, in reality, work, because joints are supposed to be moved, and if joints don't move, it actually ends up causing even more wear and tear. But is the surgery fixing the root cause of the problem, or is it again just trying to buttress something that's already broken? It's not fixing the root cause of the problem. Because I can tell you, if your back pain is because your spine doesn't have a normal curve, or from the front it's all shifted like this, how the heck is that going to help you long term? It's not. It might at best buy you some short-term relief. But it's actually only going to create bigger problems down the road because you're going to get compensatory problems. So we need to start asking ourselves some better questions. What are the risks of these kind of procedures? What are the costs involved? Because if you try to do it on the NHS, you're going to be waiting probably 3 years at least. What are my expected outcomes? May I interview 10 of your patients? What does the research say? Are there any other options? And ultimately, is having surgery going to treat the symptom, or is it correcting the cause of the problem? Because I just spoke to you early on today about if the spine is in poor alignment for long enough, the disc is going to degenerate, right? And when they operate on the disc and they try and get rid of the bulged disc, but if they don't change the alignment of the spine, what do you think is going to happen to the disc above it and below it? Given enough time. It's going to go the same way, right? So let me just put it to you like this. If you've got a car with poor wheel alignment and you keep getting a blowout in the front right tire, it's because obviously the alignment's wrong and the tire's undergoing abnormal wear and tear. Now we don't just take our car to the garage and expect them just to replace the tire. What would you expect them to do? Fix the alignment, fix the wheel alignment. Now, is that happening to us when we go for spinal surgery? No. They're fixing the tire, so to speak. They're getting rid of the bulged disc, but the alignment is still messed up. And so that's why the disc just blows again, or the disc above and below it blows, which is why it has a poor outcome. And if it's not the disc that's causing the pain, and it's the joint, well, obviously then, if you don't fix the alignment, you're going to keep getting spinal problems. And you're just going to end up on this merry-go-round of taking more and more meds. And if those don't work, we put you onto stronger meds. And if those don't work, we put you on even stronger meds. And this is how people can end up in this downward spiral. So we've got a huge problem in the Western world at the moment with how we're treating chronic pain. We have to fix the cause of the problem. If we don't address the cause, we're not really making that person's life better in the long term. You see, when we get pain, it's a fire alarm. Our body's trying to tell us something's wrong. Don't just disconnect the battery, which is what the pill does. We need to put out the fire in the back. All right, so these are all fire alarms. They're all signals, body signals. That's why we call this program the Body Signals Program. They are symptoms or signals that your body is trying to tell you to give you an idea that something's wrong. You either got to change something or do something totally different. Sometimes the body just whispers to you, but sometimes it screams at you. But either way, we've got to try and listen to it. So think of symptoms as a bit like the tip of the iceberg. Okay, it's the part that you can feel. That's the noticeable part. But the cause is what's really happening below the water. There's no point chipping away at the top of the iceberg unless we deal with this. Does that make sense? All right. Okay. So when we look at what we call an illness-wellness continuum, all of us are on this continuum moving either this way or this way. You're not static. All right? You're either moving this way or this way. And you've just got to be honest to yourself, which way are you moving? We all obviously want to be heading this direction, which starts with awareness and education and what you need to do to take action. And your body alerts you to the fact that you're going this way when you start to experience signs. What's the difference between a sign and a symptom? Well, a sign is something that you might not necessarily feel, but somebody else can point out to you. So for example, if you go to the doctor and he says bend over and you try and touch your toes, you suddenly realize you can't actually touch your toes. You didn't even realize you had a back problem until you realize you just don't have much flexibility. So that would be a sign. Whereas a symptom, obviously now you're experiencing most likely pain, but it might not be pain, it might be numbness. Okay, or it could be recurrent IBS, bowel problems, because those nerves in the lower back, remember, supply all this area as well. Or it could be loss of power in the leg, etc. Okay, whatever it is, bladder issues, and. Those are symptoms. And if you continue in that direction, it's just going to get worse, leading to disability and premature death. So we need to do a U-turn and head you in this direction, not with just education, but with showing you how to take action, and then you've got to then take action. All right, and hopefully we're going to be able to show you how to do that. So just a reminder, less than 10% of your nerves sense pain. Less than 10%. So if this is a cross-section of a nerve, this portion here is the only part that's really responsible for pain. The rest is concerned with function. So when I say the word nerve, what should start to now be associated in your brain is not pain, but it should be function. And so when you start to get problems in the spine, it's not just affecting pain. In fact, you might have no pain for decades, because pain normally is a very late symptom to come. By the time pain normally comes, the problem normally has been there for a long, long time. It's one of the last symptoms to come as you get worse, and often it's one of the first ones to go as you get better. So just because you're out of the pain window doesn't mean to say your problem's gone. This means it's dropped below that critical threshold level of where you're now experiencing a symptom. Does that make sense? So if you start noticing digestive system problems, breathing problems, low energy, sinus, allergies, weakness, spasms, fatigue, tightness, postural issues, these are all indicators that you've probably got problems in your spine. Okay? but you might not have any pain yet. Okay, so we're going to do a quick crash course on how your nervous system works here. So here's your brain. Your brain is constantly sending messages down through the spinal cord, out through all these nerves, to every cell, tissue, and organ in your body. Your body in turn is then sending messages back via these nerves, back up the spinal cord, back up to the brain to tell the brain what's going on. So there's this constant communication between brain, body, and brain. And if that's flowing really well, we get to be healthy, our body functions well, it heals and repairs well, we have normal healthy metabolism, and it moves well. Remember, what does your brain control? Brain controls everything. But how's it going to get its signal to whatever body part needs to be activated or doing whatever it needs to do? Through the spinal cord and nervous system. So if your nervous system is now full of interferences or disruptions or blockages, can you see how the brain now can't control the heart properly? If perhaps you have a blockage here, because that's where the nerve goes to supply the heart. Can you see how that might happen? So a person might start to experience things like palpitations or even heart conditions. If a person develops a blockage in this part of the nervous system here, it might affect everything from here down. So it might not just be headaches that they start to experience, but they could be getting back pain and headaches and sinus problems and also digestive system problems and. You know, problems, blockages in this area of the nervous system can obviously affect large sections of the bowel. Blockages here can affect, again, large sections of the lower bowel, bladder, and obviously things like legs, etc. But it also could cause pain. But you could have a blockage in any aspect of your spine without any pain at all. But you might notice some of these other symptoms instead. So a couple of things that we need to try and understand first about your body. Healthy is normal. Unhealthy is abnormal. So just because there's so many people struggling with chronic low back pain or chronic health problems, it doesn't mean to say it's normal to get sick or to get back pain. It's just become so common that it's become the new normal. Your body is programmed to be healthy. Healthy is its natural default. If we give the body what it needs and we remove what it doesn't need. And it doesn't need blockages in the nervous system. And the name we now give to these blockages in the nervous system is called a subluxation. Can you all say that? I'm going to say that on 3. 1, 2, 3. Subluxation. Subluxation. I know it's a real mouthful of a word. It basically comes from the Greek word disconnect. So essentially the brain-body is not communicating properly anymore. And that wrecks your nervous system. And because your nervous system is the master system, it can affect all sorts of problems. Now, would you agree then it's smart for your body to tell you that there's a problem when there's a blockage in the nervous system? So is it smart that it gives you pain? Is that a good thing?
Yes.
Yes! So does it make sense for us to suppress that pain with drugs? No. No. Your spine is the suit of armor that protects the nervous system inside it. So if your spine is all out of alignment and your posture is all out of whack, how well is your nervous system going to work? Not great, right? So can you now see why assessing your spine alignment and posture is critical if you want to have a healthy nervous system and therefore a healthy body? Would you agree that modern life is unnaturally stressful? Yes or no? Yes, I think we kind of agreed that earlier on, right? Because it's not just bad postural stresses that we're talking about. Obviously, that's a classic physical stress. But also it will include traumas, toxins, and thoughts. It's what we call the 3 T's. Thoughts, toxins, and traumas. And we're being inundated with more and more of this stress every day of our lives, whether it be macro trauma or micro trauma, or even worse, technology trauma. This is pretty much us most of the time now. And this is why we're starting to get more and more problems like this. So I've got 2 x-rays here. This is a normal healthy lumbar spine facing this way now. Okay, so this would be the front of the spine, front of the low back, and this is the back of the low back. Right? And this would be the bum. Right? So can you see the green curve here? It's sitting right along the back of the vertebral bodies here. It forms a perfect ellipse, a bit like the shape of a rugby ball, if you were to extend it right around. That's what a normal low back should look like. But when we get exposed to all these stresses, over time, the low back starts to straighten out in some people, or it can become too curved in other people. See the red dotted line here? The green curve is where you should be. The red line is where this person is. Likewise with this one, the red line, there's virtually no curve in this low back here, whereas it should be along the green curve. Also, you'll notice the low back has come backwards behind the green curve in this one, whereas in this one it's come too far forwards. Can you see those differences? That causes different types of low back pain and different types of low back problems. But not just low back problems only. It could cause also bowel issues, bladder problems, tingling, sciatica, etc. This particular, remember, this is normal healthy, okay? The green is normal, the red is where you are. Some people, it starts to come so far forward and the curve becomes too excessive that even this vertebra starts to shift forwards on this one. Can you see how it steps here? Okay, so it's what we call an anterior spondylolisthesis. Essentially, it's a fancy word for the vertebra is slipped or shifted forwards. And what do you think it's doing to this nerve root here? Sharing it, okay, causing a lot of problems. Remember, what do nerves do? They control organs and tissues, okay, not just pain. So it can also affect now how well organs are working. Now here's the thing, is looking at the person's posture, to an untrained eye, you might not notice any major differences in the low back. But this kind of low back problem needs a completely different approach and treatment than this type of low back problem. Now, how are you going to know that unless you've had an x-ray? If you just do a whole bunch of core strength exercises like the physio tells you to, which are generic most of the time, how's it going to differentiate between fixing that problem and that problem? It can't. No exercise could. There is no generic exercise that can fix that. So what we really need to do is come up with specific exercises, specific adjustments, i.e. thrusts to the spine to actually try and restore normal alignment again, and specific traction to the spine that can help pull it back into a normal position again. But you need the x-ray to be able to know, A, how to do that, the angles, the degrees, and how far you need to take it, and which direction you need to take it. Does that make sense? So can you now see it's almost impossible to get long-term spine or posture correction without a proper x-ray. These are weight-bearing x-rays, by the way. So it's a person's normal neutral posture when they're standing. How many of you would agree that no amount of cocodamol in the world is going to get that lumbar spine closer to the green line? Does it make sense then that we try a different approach? Yes or no? Yeah. Yes. All right. So essentially what you're seeing here, all these misalignments, are subluxations, areas of the spine that are not moving properly because they're out of alignment, and it's stressing the nerves, all right? Causing also things like soft tissue damage, inflammation, nerve irritation, muscle spasm and pain, lost imbibition, which basically means the loss of the fluid intake in the discs, so the discs degenerate, joint fixation, movement deficiency syndrome. Basically, your back becomes stiff and rigid and like a board. How many of you would agree that your back is not moving so well at the moment? Yeah, okay, because you've probably got subluxations. But the problem is you don't know whether you've got a problem like this or whether you've got a problem like this. Or it could be a normal lumbar spine from the side, but from the front, your spine could be doing this because you're all shifted over. Now can you see there's a big gap between this arm and here, and there's no gap here? It's because you've got what we call a translation of your rib cage relative to the pelvis. Okay, and standard core strength exercise is not going to fix that. So if you're like this, what do you think you need to do? About a gazillion of these. Okay, maybe not a gazillion, all right? But you need to do a lot of these exercises, but just doing the exercise alone is not going to fix it, because probably there's so many adhesions and scar tissue there, you also need the adjustments and the traction to do it as well. All right, so it's a three-pronged approach. Adjustments, traction, exercises, all right? That's what's going to correct these kind of problems. Okay, and the spinal adjustments that we do are gentle. I know some people they watch some of these YouTube clips and they see these guys being absolutely racked. It's gentle compared to what most people think. All right. An adjustment essentially is a very fast thrust, but it's low force. What's the key word there? Low force. Okay, but it's very fast. Okay, and that's what helps move the vertebra and creates that stimulus to the nervous system, which when you combine it with the exercise and traction, you're going to get permanent long-term changes. So when we re-x-ray a person, we would expect those to be better. So we know it's not just placebo, okay, that you're now feeling better. We typically, on average, get a 50% objective change in a re-x-ray as an average. It's going to obviously depend upon your age, how much damage is already there, how often you're doing your exercises, etc. And for most people, that'll translate to an 80 or 90% subjective change in terms of how you're feeling. What you've also got to understand is when your spine stops moving properly, it increases stress through to the brain. You see, don't look at that for a moment, because I know when you all look at a light, you all kind of fall asleep. So the better your spine moves, the better it stimulates the brain. The worse the spine moves, the brain stimulus is reduced, i.e., the better your spine moves, the more stress inhibition occurs in the brain. The worse the spine moves, brain stress is no longer inhibited anymore, and it continues to go up. So this is why you'll even notice you're more stressed, you're more anxious, you're not sleeping well at night, because your brain stress is going up. But also when your brain gets stressed, your blood pressure goes up, your heart rate goes up, muscle tone goes up, tension, digestion is upset. Reproduction or sex drive goes down. Decreased serotonin levels. You become depressed. You literally become depressed. Increased sensory systems, meaning you get increased sensitization to pain. So you now even feel even more pain because your body is just on the alert fight-flight state. Basically, your body is stuck in the fight or flight state here. Immune response is down-regulated because when your body is stressed, it's not interested in boosting your white blood cell count. When your body is stressed, it's thinking it's fighting lions. How many of you would agree that white blood cells are not going to save you from a lion trying to rip your head off? So your body doesn't care about white blood cells, okay? So your immune system down-regulates. And how many of you would agree probably now is not a good time to have a down-regulated immune system? Yeah, okay, but at any time. Insulin sensitivity is down-regulated, so what's that going to increase your chance of? Diabetes. Blood sugar up, decreased HDL, increased LDL. Basically, more of the wrong cholesterol, increasing your chance of blood clots, increasing chance of heart disease, stroke. Clotting factors increase. Can you now see how, just from a spine not moving properly, it increases your risk of virtually every single chronic illness there is? And you thought you were here because you're worried about back pain. We've just upped the ante, haven't we? It has a massive effect on your health. And the tragedy is people don't understand this. So when I said right at the beginning, you know, we can dramatically reduce your chance of ever developing a chronic illness. Some of you thinking, he's waxing poetic. But this is why. Does that make sense? Okay. Some do's and don'ts. We've got to stop doing some things, slow down doing others, and start doing furthermore still. So what have we got to stop doing? Well, I can tell you right now, sitting is the new smoking. Reduce the amount of sitting time is absolutely going to help. So get your ergonomics sorted out with your desk. Start walking more. Make sure you're doing at least 20 or 30 minutes of walking every day. Movement is life, because when your spine is moving well, remember this part of the brain in particular gets charged up. So not only is that going to reduce your brain stress, but also the better your spine moves, the better the prefrontal cortex can work to control 5 key things. The first being your autonomic nervous system. So when this part of the brain works well, all your organs work well. That's what your autonomic nervous system is. It's your organs. But for those of you who can do some form of movement that doesn't cause pain, whatever movement you can do, do it, as long as it doesn't cause pain. Okay? And that's also where the adjustment comes in, because what we can do is we can get a lot of movement in parts of your spine that are stuck and not moving properly with minimal pain, often no pain at all. And now we can break the cycle, okay, of movement and pain. But also, the better we get your spine moving, not only are your organs going to start to work better because this part of the brain gets charged up. So think of your spine kind of like a generator, and the front of the brain is like a battery. The better the spine moves, the better the battery is charged up. The worse the spine moves, the battery goes flat. And when this part of the brain goes flat, the autonomic nervous system, as I said, is affected, but also your immune system is affected. Also, your hormones are often affected. So especially in women, it can lead to mood swings, menstrual problems, even infertility issues. But in men, it can also affect mood and sleep. It also controls higher cognitive function. So things like focus, concentration, memory, and learning. So you might notice, how many of you have noticed you're getting some brain fog and your short-term memory is not as good as it used to be? I know for a fact that some of you are going to be that case, okay? Because this part of the brain is starting to shut down. So it can even reduce your risk of dementia and Alzheimer's as you get older if we keep the spine moving and free of subluxations. And then also it can control inflammation, which is very relevant if you're struggling with chronic pain. Here's why. This part of your brain regulates inflammation. How many of you know that inflammation, too much inflammation causes pain? Yes? Okay, which is why you're told take anti-inflammatories. The problem is if your spine is not moving properly because it's full of subluxations, the part of the brain that normally regulates inflammation can't work properly. So you become too inflamed. And so you're going to experience even more pain. So getting movement back in the spine is absolutely critical. But you've got to do it in a way that doesn't cause more pain. Okay? All right, and this is where obviously strategic exercise is helpful, but also the spinal adjustments are crucial as well. Try and also reduce the amount of inflammatory foods that you're eating, especially cereals, grains, processed foods, because those are very high in omega-6 fatty acids, which are inflammatory. And you want foods that are anti-inflammatory. So lots of fruits, vegetables, seeds, nuts, grass-fed meat, and fish oil, okay? Or flaxseed oil if you're vegan or vegetarian. Fish oil in particular can be really helpful. So supplementing with some omega-3 fatty acids, you don't need the 6 and the 9, you just need the omega-3. That's what you're going to be deficient in. It can also help reduce your inflammation and help get you to the point where you can start moving more without pain. So you should be taking some form of fish oil supplement every day, which will increase your omega-3s, which are anti-inflammatory. Reducing the amount of processed foods and grains, which are inflammatory, will help reduce those omega-6s, okay? And it's getting that balance right. And then start to get rid of the subluxations. Get to a chiropractor and start getting adjusted. And then we will be able to prescribe you the right exercises as well as any appropriate traction that may be needed. How do you know if you have a subluxation? Over and above pain, you might not have any pain at all, okay? Well, the criteria is really we can feel palpation. You can feel where the spine is stuck. It's not moving properly. Okay? That's what we train 6 years to do. Posture. Postural abnormalities are normally the earliest indications of subluxations because as the posture is off, so the spine and nervous system is off as well. So I've told you straight away now, if I'm doing this, you can see my rib cage is all shifted. I clearly have a subluxation problem in my thoracolumbar area. If from the side I'm standing like this, pelvis is forward, shoulders rounding, head forward, okay, that's causing huge stresses on my lower back here and in the base of my neck. But X-ray at the end of the day is going to be the gold standard because whilst we can see gross distortions, we can't really see what the curves of her lower back and her neck are doing. And that's where the X-rays really come into play. because that's going to hugely determine then what kind of care you would need. We're seeing, I mean, probably 250 to 300 people a week here, and every single person is on a slightly different program because it's customized exactly to what that person's issues are. Right? It's not a generic one-size-fits-all. So there are a few exercises which can be done by everyone, but most are going to be specific to their specific postural abnormalities and their specific subluxation issues. Likewise with the adjustments and also the traction. But also we can measure how well the nervous system is working through what we call a stress response evaluation. So we can actually measure how well the brain body is communicating. Okay. Those of you who've got any burning questions, I will be available here just for a few minutes afterwards. But remember, the sooner you can take action, the more likely you're going to actually get a breakthrough. The longer you leave it, the longer it's going to take to correct, and normally the harder it is to correct as well. Thank you all very much, and have a good evening.
Cheers.
Thank you.